Well, May is Older Americans Month, a time to bring attention to the things we need to be aware of as we get older.
Joining us today are clinical coordinator Annie Mowrey and Dr. Jared Price, who is a wound specialist physician with Portneuf Medical Center. Thank you both for coming in today.
Thank you.
You know, as we get older, it sounds our skin just does not hold up as well, and some problems can come about. What are some of the most common problems we see?
Well, some of the common problems we see are things like skin tears. The skin becomes thin, and it doesn't take much for that to tear a small little bump or things like that. We also see lower leg wounds that come usually associated with other medical conditions such as diabetes.
So as we do get older, what are some of the things that we need to be looking out for? Are there signs that this is happening to us, or are there things we can do to maybe delay that a little bit?
Sure, yeah. Probably one of the biggest things and simplest things is to make sure that you're having regular checkups. So if you have something like diabetes or other medical conditions, the better that those are controlled, the better your overall health and the less likely you are to have problems with your skin. Another simple thing to do is just make sure you're getting adequate nutrition, specifically protein in the diet. I think is something that is missed a lot as we start to age.
How does nutrition and diet make such a big difference with your skin? I guess I wouldn't have made that connection.
Well, as we age, our skin begins to thin, and so there's less padding there. And so when there is something like a skin tear or you know, an injury to the skin, in order for that to heal, it needs building blocks, and those building blocks come from the protein that we get in our diet.
So Annie, as we do get older, because it's going to happen to all of us, what do we need to do as far as our medication goes? It seems like the older we get, the more medication we need. Is that something that's just an inevitable reality?
Not necessarily. The better you take care of yourself, the healthier you are, and you can prolong a lot of medical conditions just simply by taking care of yourself. Regular exercise, seeing your doctor regularly, and good nutrition are the things that I recommend and are on the top of my list as far as good things to do to keep yourself healthy longer.
Okay.
Also, with if you are on medications, it's a good idea to keep a list of those medications with how often you're taking them, what the dose is, and if it's a temporary medication, maybe when it started. And that really helps out with, especially when seeing a new physician, so that they kind of know what your history is and make sure that we're not giving you a medication that's going to interact with some of the other medications you're taking. So having that list is pretty.
Not just leaving it up to your memory. I'm not on very many medications.
Speaking of getting older.
That sounds like a good idea. Now, I understand that balance is also a big issue as people age as well, something to really watch for.
Definitely. As we become older, our balance can be off for multiple different reasons. Maybe a health condition like diabetes. As your blood sugars get high, they trend throughout the day to highs and lows. They can offset your balance. Also, blood pressure medications. You'll want to be careful when you stand, change positions. Make sure that everything is in good equilibrium before you go to take off across the room.
Okay.
Absolutely, our balance is affected as we get older.
Are there exercises that we can do to kind of keep things limber so that we don't, you know, when we do that stand up, the snap, crackle, and pop Rice Krispie effect, we can just...
Sure, you know, and a lot of that depends on the person's situation, but certainly regular exercise, even something as simple as standing up and sitting down in a chair, or some, you know, non-weight calisthenics.
Just get some movement in you.
Yeah.
Okay.
Things like Tai Chi or simple yoga exercises can be beneficial, and you know, and you're less likely to cause an injury with something like Tai Chi than maybe going to the gym and lifting weights.
Yeah. All right. Some MMA going with it.
Yeah.
All right. Well, thank you so much for coming on. That's good information. Thanks.
All right.